Well, first of all, thank you everyone for joining us today. I first want to thank my friends from Harvard Medical School, the Harvard Law School Center for Health Law and Policy Innovation, Northwestern University, and the Nutrition Education Working Group for their support over the last few years in crafting this important legislation. 3 years ago, I met with the Nutrition Education Working Group, who first brought this problem to my attention. Since that time, we have been working together on this issue, and I'm grateful for all that they're doing to help expand nutrition education programs. I'm proud to introduce this resolution this week with my colleague, Congressman Michael Burgess from Texas. This legislation calls on medical schools, residency, and fellowship programs to provide increased nutrition education to medical students and physicians. For way too long in this country, we have treated a person's health and a person's diet as separate. Don't take my word for it. Look at the data. In the United States, medical schools devote an average of 19 hours to nutrition education over 4 years. Let me repeat that. Medical schools devote an average of 19 hours to nutrition education over 4 years, with little of that related to diet and common health conditions. You heard that right. And the American people are paying the price. In 2018, more than 40% of American adults were obese, and more than 1 in 10 adults suffered from diabetes. Food is medicine, and all too often it is underutilized as an intervention for addressing diet-related diseases. Instead of prescribing drugs to cure these diseases, there are places where food can help alleviate suffering and address the underlying conditions. These are chronic health problems that cost programs like Medicare and Medicaid millions and millions and millions of dollars. And the federal government is doing next to nothing to prevent them at a systemic level and give those on the front lines, our healthcare providers, the tools needed to help people eat healthier. So we cannot continue to ignore the direct correlation between a person's diet and their health. And this starts with making sure our medical providers are equipped with the knowledge and tools to help their patients. We also must note that as we introduce this legislation this week, the COVID-19 pandemic continues to impact all of our lives. Study after study shows us that COVID-19 related food insecurity puts more Americans at risk for obesity, and that having obesity may triple the risk of hospitalization due to COVID-19. Nutrition, food access, and a person's health are not only directly connected to each other, they are directly connected to our progress as a nation. It is time we treat them as such. So this new bipartisan resolution takes an important step in that direction so that our medical students and physicians are given the training they need to improve nutrition among patients. And I'm proud to introduce this alongside of so many brilliant and passionate advocates and leaders in the field of nutrition education, who you will hear from in just a moment. With that, it is my pleasure to introduce Dr. Walter Willett, who serves both as the co-leader of the Nutrition Education Working Group and as a professor of epidemiology and nutrition at the Harvard T.H. Chan School of Public Health. Doctor, I'll turn it over to you.
Thank you. And on behalf of many colleagues, I would like to thank Representatives McGovern and Burgess for proposing this resolution to address the need for a greater emphasis on nutrition and medical education. If we step back, our systems of medical education and healthcare are clearly failing. If you look at the numbers, they deserve a big fat F. America spends vastly more than any other country on healthcare, about 50% more. And what do we get for this? Life expectancy has declined 3 out of the last 4 years before the pandemic, and now has taken another huge dive, in part due to poor survival of people with nutrition-related conditions who developed COVID-19. Even before the pandemic, we ranked below number 40 in life expectancy, next to Romania and Cuba. People in Japan now live 5 to 6 years longer than Americans. As has been noted by Representative McGovern, poor diets are the most important underlying cause of death and suffering in this country. But education on nutrition and health is minimal in most medical schools, including at my own university, Harvard. This is part of a huge imbalance whereby almost all attention is given to treatment of diseases rather than preventing these diseases by keeping people healthy and happier. Physicians, 86% in one survey, know they are not prepared to advise patients about nutrition, and medical students understand that they have a major gap in their education. Hopefully, leaders in medical education will heed this appeal to address the glaring lack of nutrition in their institutions. Otherwise, I suspect that Congress may find other ways to spend the $14 billion that we provide as a country for medical education and find more effective ways to promote the well-being of Americans. Thank you again, Representatives McGovern and Burgess. And I would next like to introduce Dr. Stephen DeVries, who's a preventive cardiologist and co-leader of the Nutrition Education Working Group.
Thank you, Dr. Willett. I'd like to thank Congressman McGovern and Congressman Burgess for their work to expand access to life-sustaining nutrition. And that's exactly what we're talking about today. I'm the co-leader of the Nutrition Education Working Group, a passionate group of nutrition educators, scientists, and health policy experts, all dedicated to revitalizing nutrition education and practice in medicine. And today I'm speaking in my personal capacity as a preventive cardiologist. In over 3 decades as a cardiologist, I've had the privilege to care for thousands of wonderful people and to help patients and their families deal with the terrible burden of disease and disability. And here's the saddest part. So much of this misery could have been avoided. The data is as clear as it is provocative. 80% of heart disease and fully 90% of type 2 diabetes completely preventable through diet and lifestyle changes. If food is medicine, too many patients are taking the wrong drugs. Clearly, physicians don't have control over all the factors responsible for poor quality diets. But at present, their lack of training in nutrition prevents them from even being a significant part of the solution. Can you imagine this? As Congressman McGovern said, on average, 19 hours of nutrition education over 4 years of medical school, and very often none whatsoever in the years that follow. There are 0 competency requirements relating to nutrition for training in internal medicine, as well as my own field of cardiology, and even unbelievably in pediatrics. And so it's no surprise that physicians emerge from training feeling completely unprepared to help their patients with nutrition. A national survey that I led of cardiologists, for example, revealed that 90% of practicing cardiologists received no or minimal training in nutrition. Another survey found that 86% of physicians felt unprepared to counsel their patients on nutrition. So the question is, why aren't physicians receiving the nutrition training they need? Medical schools and residency training programs often report that they don't have time in their curriculum to teach about nutrition. But since poor quality diet is the leading risk factor for death in this country, it's hard to understand what could be more important. And yet somehow time is always found in the curriculum to teach physicians about the newest pharmaceutical or procedure. There is a serious deficiency of nutrition education in medical training, one that has been given little more than lip service for far too long. The public trust demands more, and so does the state of our health. There has never been a greater opportunity for medicine to embrace what we already know about the potency of dietary changes to help prevent and treat disease at low cost and with only positive side effects. And very importantly, physicians who are better trained in nutrition are more likely to recognize opportunities to make much needed referrals to nutrition and diet professionals. I couldn't be happier that this resolution sheds light on the fact that nutrition is truly the low-hanging fruit in medical care, and that the time to ensure that physicians are better trained to harness its power is now. It's my great pleasure to now introduce Emily Broad-Leib, Clinical Professor of Law and Faculty Director at Harvard Law School's Food Law and Policy Clinic.
Thank you so much, Dr. DeVries, and thank you to our good friend, Representative McGovern, for introducing this, as well as Representative Burgess for their leadership on this topic. As you heard, I serve as faculty director of the Harvard Law School Food Law and Policy Clinic, and several years ago, I actually had a medical student who cross-enrolled in my course at Harvard Law School and shocked me with the fact that he had come all the way to the law school just to learn about food. So after hearing his complaint, I was intrigued and I really wanted to understand more. I went home and asked my dad, who's a gastroenterologist, about his knowledge about food, and realized that he also didn't know anything about food or nutrition. So my student connected me to the Nutrition Education Working Group, and for the past several years, we've been working together to really map out the decision makers and policy opportunities that could support increased nutrition education for health professionals. And in 2019, we published a comprehensive report entitled Doctoring Our Diet, Policy Tools to Include Nutrition in US Medical Training. So through this work, I've had three big learnings. First, I learned that this is really an issue of national concern, as we've just heard from Drs. Willett and DeVries. There's a severe deficiency of nutrition education in all phases of medical training. Second, I learned that the federal government is facing a dual burden of rising healthcare costs, as well as the ongoing federal contribution to the cost of training health professionals, especially through graduate medical education, which is the residency and fellowship stage of medical education. So it's undisputed that healthcare costs are rising. In the next 10 years, Medicare spending is expected to exceed $1 trillion. And at the same time, much of this increase is really attributed to epidemic rates of diet-related disease. 5 of the 8 most common conditions for Medicare beneficiaries are diet-related. And at the same time, the federal dollars provide the single largest funding source for residency and fellowship programs, annually paying about $15 billion per year for graduate medical education. So to my mind, it doesn't make sense to invest federal money in training of physicians who are then not able to prevent or address the most common and costly illnesses we face. And third, I learned that there are really a variety of options, carrots and sticks and everything in between, that the government, that private accrediting bodies, medical schools, and teaching hospitals can do to address the missed opportunities in this space. So given that, what does this resolution do? Well, the resolution does not mandate any changes to healthcare training. It really raises awareness and makes the statement that the lack of food and nutrition knowledge amongst health professionals is a matter of national concern. The resolution then encourages action in several key areas. It encourages physician and other health professional training programs to provide meaningful nutrition education. It urges federal agencies to provide oversight in order to ensure that federal funding goes to the schools and training programs that offer nutrition education. And it calls upon those agencies to fund research and to support development and dissemination of curricular resources. Lastly, it calls upon the government and private institutions to raise awareness of the critical role of diet and nutrition in health and the responsibility of healthcare professionals to promote healthy diets. So there are plenty of opportunities to invest in nutrition education for doctors and necessary investment to improve individual patient outcomes, to advance population health, and to change the healthcare landscape for the better. I couldn't be more delighted and grateful for the leadership of Representatives McGovern and Burgess. And now I'm really happy to turn it over to Elena Beaver, who's a joint MD PhD student at Harvard and has long been active in our Nutrition Education Working Group.
Thank you, Dr. Broadleib, and thank you again to Representatives McGovern and Burgess for this opportunity for me to offer a student perspective on medical education. So I came into medical school with a significant interest in chronic disease prevention, especially through nutrition and lifestyle interventions. And during my first 2 years of medical school, nutrition came up only a few times in lectures, primarily in the context of diabetes management and the pathway of cholesterol metabolism. And during these classes, the nutrition-related topics were introduced to us, but never tested. And I did not get the sense that students finished our preclinical curriculum with a solid understanding, or any understanding for that matter, of how nutrition plays a role in disease prevention and management. Although our lecturers hinted at the importance of diet in health promotion, my classmates and I were left wondering where to learn more about nutrition, as well as how to translate this knowledge into clinical practice. The absence of nutrition content in medical education became especially apparent to me while I was studying for Step 1, the first part of the United States medical licensing examination. The nutrition section of this exam was limited to vitamin deficiencies, with no explicit mention of the role of diet and food access in supplying the vitamins and minerals and other nutrients that are necessary for basic healthy functioning. The lack of standardized nutrition content on this exam is one manifestation of a general lack of curricular resources for medical training. In my own experience, when I met with faculty members and program directors to discuss how we could incorporate more nutrition content into the required coursework, the primary barrier was not a lack of enthusiasm, but rather a lack of resources on how and what to teach with regards to nutrition. During my time as a student, I have been grateful for opportunities to fill in these gaps through extracurricular seminars. Through the Harvard Lifestyle Medicine Interest Group seminars, which were regularly attended by a large group of fellow students with interest in nutrition and lifestyle, I learned about a variety of nutrition-related topics from experts. These included how to engage with patients through motivational training, the latest research on a healthy diet, and the efforts of the Massachusetts General Hospital to provide a food pantry stocked with minimally processed, nutrient-dense foods for patients who struggle with food insecurity. I'm very optimistic about the enthusiasm from my classmates and colleagues with regards to integrating nutrition into medical training, and I intend to continue working towards creating opportunities for students who want to gain more nutrition knowledge. Our efforts would be greatly supported by more nutrition content, both in the curriculum and on our standardized exams. Thank you very much.
Well, thank you very much. And I want to thank everybody again for joining us on this call. And I hope that you can see the clear benefit to our country that providing universal nutrition education to med students, residents, and fellows would provide. And I'm now happy to open this up to questions from the press. Matt, you'll tell us how we do that.
Yes, if you have a question, could you please use the raise hand function right now and I will unmute you. All right, Spencer, I am unmuting you now.
Yeah, Spencer Chase with AgriPulse Communications. I appreciate you all having this event. Questions for Congressman McGovern. In relation to this resolution, the event that you held recently about the White House Hunger Conference, your colleagues in the Senate held a hearing a number of weeks ago, and the nutrition education piece played a prominent role in that discussion as well. Wondering what thoughts you could offer in terms of the role that you expect sort of this groundswell of support for, taking a fresh look at some of the nutrition language in government policy, in nutrition education, et cetera. Wondering what role you think all of this fresh look will take in the consideration of the 2023 Farm Bill and the nutrition requirements, the nutrition language therein.
Yeah, well, I mean, look, the Farm Bill's a little ways off, but and some of this language, quite frankly, is more appropriately put in other legislation. But you mentioned the White House conference on health, hunger, nutrition. We want this to be a part of it, and the whole point of this resolution is really to get the powers that be in medical education to change. I mean, that's what this is about. We want change. And so this is a nudge. I expect that we will take this bill up in the not too distant future in the House. I mean, you have me on as a sponsor, and then you have Dr. Burgess. I mean, we're political polar opposites. I think a McGovern-Burgess coalition here is unbeatable. So I expect that this will pass overwhelmingly. And it's, I think, the first, kind of clear indication that we expect changes. And, there are some suggestions in the resolution about, other possible ways to nudge this along, but we want things to change. I mean, it makes absolutely no sense, given all that we know about the relationship between food, between nutrition and health outcomes, that we are not preparing our doctors better in the area of nutrition. And so we want change, and we're going to, we'll vote on this in the not too distant future. And I think it will make it clear, and then we will expect to see some results. If not, we'll have to come back and legislate more directly. So I'm optimistic. I'm optimistic. And again, as I said, we're going to have this White House conference. I expect will happen next year. Food is medicine will be a big part of it. Obviously, I think this will be I would like to think that at that time, that we will have some deliverables on this.
All right, I think next up we have a question from Megan Boynton, and I'm gonna, it looks like you unmuted, so go ahead. Perfect, thank you.
Great, thanks, Matt. And hi, Chairman. As Spencer mentioned, this is one of several moves by you recently to spark meaningful change in the public health sphere. And as with your recent bill about the White House National Conference, I know that was bicameral and you had support with Senator Booker. Should we stay posted for any support on this bill within the Senate? And would you be willing to tack this on to a larger package like reconciliation?
Well, the reconciliation thing, at least in the House, we might be, it might be pretty frozen in terms of what moves out of the House at this particular point. Look, we're going to pass this in the House. I mean, this will be passed, and I think what you can expect is a growing impatience amongst members of Congress as to as to the status quo. I mean, we've had many conversations with the people who are responsible for accreditation of our medical schools, with deans of medical schools, with you name it, and everybody seems to be in agreement that nutrition ought to play a more prominent role in medical education. What is missing is action. So, so I think, we have this White House conference that I expect will be happening. My hope is that by the time this White House conference is up and running, we will have some deliverables on this matter. If not, then you can expect, more direct legislation in both the House and the Senate. And I think that, again, you all know my political philosophy. You all know Dr. Burgess's political philosophy. We can barely agree on what to have for lunch, but we agree that this should be a priority. And the same is true over in the Senate. So the issue of nutrition is rising in terms of focus and importance. And again, we want action. And this is a signal to the medical schools, to the people who are in charge of accreditation, to the people who design the curriculum. We expect results. So that's what this is about. So, you can expect a lot of action, especially if there is inaction. But my hope is that this should be a signal that, we're looking forward to, to some positive announcements in the not too distant future. I don't know if my other colleagues on the call have anything they want to add.
Thank you, sir.
If there are any other questions, can I just remind you to use the raise hand feature and we will unmute you.
Oh, maybe, Matt, if I could just add a little bit to Congressman McGovern's comments, which we, again, tremendously appreciate. And the way to do this is not totally unknown to medical schools. Actually, we had quite a good course at Harvard until a few years ago when, in the name of curriculum reform, it was eliminated. And it was a course on prevention. Nutrition was a major part of it, but it also focused on helping patients stop smoking, helping patients be more active, and also preventing mental health issues too. And what the most important thing, we actually evaluated this course, and one of my colleagues published that. Perhaps the most important finding was that after our course, half of the students changed their own diet. And that is actually the most important step here, because like most Americans, many medical students and physicians don't follow a healthy diet themselves, partly because they don't actually know what it is. And they're not going to be proponents of healthy eating with their patients and their institutions unless they have good diets themselves. And that's a very important step. And then 80% said that they felt more confident counseling patients. And the course got very high ratings by students and actually an award. So this isn't mysterious. Other schools are working hard. Stanford has a good program that they're rolling out now. So this isn't a mystery on how to do it. It just is an issue of setting priorities. And here, nutrition should be the foundation of good health. And there's hardly anything more important than that for physicians to know, understand, and help their patients improve their well-being this way. So again, it comes down to an issue of will, and we greatly appreciate this, what I think will be an important stimulus by us, this resolution. Thank you.
I couldn't agree with those points anymore that Dr. Willett had just made. And Congressman McGovern, I would say that your remarks were so spot on in terms of now is the time for action. There have been countless white papers written in medical journals about the need to do more with nutrition education. And despite all of those white papers, there has been so little action. And I believe the reason for that is largely inertia in medical curricula, that nutrition hasn't played a large part, and so it's hard to make changes. And also the appeal of high tech, I think, is very high in a number of quarters. But as you made in your remarks, Congressman McGovern, early on, the time is perfect now to make a move. It's perfect because COVID, as you mentioned, has taught us that the most of the most significant comorbidities for severe COVID are diet related. They're diabetes and heart disease. So there has never been a time like now to make this happen. And I think the kind of nudge that your leadership, Congressman McGovern and Congressman Burgess have put into motion in your offices is, I think, going to be really a powerful force to finally make some much needed change. So thank you for that.
Are there any other questions? All right, well, seeing none.
If I could just say, so let me just be clear. So what we're doing here, this is a nudge. And if this doesn't work, then we go to plan B, which may be a kick in the ass. So I think we're laying the ground rules here, but we're serious about getting this done. So with that, I yield back.
All right, folks, I think we are going to wrap up just to be respectful of everyone's time. I'm very grateful. I am going to send a link of this recording to everyone who RSVP'd. And I thank everyone for your time and have a wonderful day. Thanks.